Honey, it turned blue again.
I think it's about time you tie them bad boys up.
What?
Oh, hello. A tubal ligation is a surgical procedure in which the patency of the fallopian tubes is interrupted within the isthmic region.
I have to have my tubes tied? So you're saying it's fair that I've had to carry all 4 of our kids, that I birthed them, and now I'm having to stay at home and raise them, and now you want me to get a surgery? I think it's time for you to get the snip.
A vasectomy? I think it's better if you get your tubes tied. I mean, what if I die?
Oh, hello again. A vasectomy is an outpatient surgical procedure where the vas deferens of the portion of the genitalia that is responsible for storage and transport is cut, effectively preventing the passage of sperm into the female reproductive tract. It actually has 20 times less complications as a tubal ligation.
See?
What?
Never mind. Let's just go talk to a healthcare provider. Mr. McConnell? You'll be in room 1 and the doctor will be in to see you shortly.
Thanks, I guess.
Mr. McConnell, Ms. McConnell?
Hi.
I'm the doctor. It looks like you're having some questions about a vasectomy, so what can I answer for you?
You gotta help me out, Doc. Tell her I shouldn't get this done.
Actually, Mr. McConnell, you probably should. You know, compared to a tubal ligation, it's 30 times lower failure rate, 12 times lower mortality, 3 times cheaper with paying over $700.
What about after? Is everything gonna work?
The procedure itself is done right here in the office, and you're okay to leave after the procedure. You may experience some pain post-procedure, so it's best to rest for 48 hours after. There's very quick recovery. Your testosterone, libido, and ejaculate volume and ability for erection will not change.
Are there any complications or disadvantages?
There are risks of infection as it is a surgery, and it is relatively permanent procedure. If you feel later on down the road that you want to get it reversed, it's best to do it less than 3 years after having the vasectomy. Some problems that could arise when trying to reverse the procedure are the inability of the vas deferens to rejoin, and you can also form sperm antibodies.
Okay. How effective is this? We already have 4 kids and we have another on the way, and I'm thinking I want to be done.
Well, the perfect user failure rate is 0.1% in a year, and typical failure rate is slightly more than 0.15%. It's one of the most effective methods of contraception.
Well, sounds good to me, honey. What do you think?
When can we get back to, you know?
Sex? Well, protected sex is okay within a week, but unprotected sex should occur at least after 2 months, or roughly 20 ejaculations, as there may still be some problem with sperm in the ejaculate.
Alright, well, when can I set this up so I can stop being hounded?
Well, my nurse will be right with you to schedule your appointment.
Alright, thank you.
Yes, sir.
We should have done this years ago.
We should know.